fascinated by our NICU babies, actually, and these extremes of prematurity. I really would ask people, faculty that I was rounding with and working with at the time, what happens to these babies when they grow up? And this was back in the late 2000s. And the answer was fairly consistently, well, we don't know. We think they do okay, no matter who I asked. And it was true. They didn't know because we didn't have the same sort of data that we have now to be able to have some indications of what future looks like for these individuals. And so I kept asking that question, what happens to these babies when they grow up? Because I would shift from working in the neonatal ICU to a month later be on an adult medical ICU service or a general outpatient adult service. And that back and forth so much really made me question and think about those long-term outcomes. And I set it down for a bit. I thought, well, I'm going to do adult pulmonary and critical care medicine after my residency training. This probably isn't so relevant until I met a patient as during my fellowship training who was born in 1958, I believe, and was 32 weeks preterm. And she had the question. She asked me the question that I had always asked everybody else. Did this matter? Did my preterm birth influence this disease, this pulmonary hypertension that you're going to diagnose me with now, and these issues that I've had? And the answer again to her was, I don't know. So we have spent a lot of time studying cardiac and pulmonary outcomes after extreme preterm birth. We focus primarily 32 weeks and less, recognizing that degree of prematurity is associated with most of these findings. So the more extremely preterm the individual was born, the more likely they are to have these sort of late sequelae that we'll talk about. So I'll start with heart. One of the biggest findings that we have identified from the preterm heart is that over the course of the lifetime, from childhood through early adulthood, the heart structure is actually slightly smaller. The ventricular or chamber sizes are smaller, are shorter, but the overall function for the majority of individuals in early adulthood is still normal. We do wonder whether this will be associated with higher rates of heart failure or heart disease as these individuals age to 50, 60, 70, but there really isn't data to confirm or deny that at this point because we really have a fairly young, relatively healthy. Because the heart size is smaller, we think that it may lend to exercise impairment or difficulty exercising for some of these individuals. Not everyone, but certainly some of them. And why is that? Well, if the heart itself is smaller, as someone goes to exercise, they increase how much blood flow the heart is pumping. And with a smaller heart, they cannot pump as much blood flow as quickly and may have limitations to what they're able to do for some individuals. We've also looked at the pulmonary pressures or pulmonary hypertension in these individuals. And in those who are more extremely preterm, I would estimate that probably around 40% have mild elevations in their pulmonary pressure, sort of borderline for pulmonary hypertension. But I think over the course of the lifetime, likely to have implications that we're trying to understand as these individuals age.
In terms of reflecting on your journey so far, and it's been such an amazing research career, what would you say is the most rewarding aspect of your work so far?
Two things. I love getting to meet our former preemies and hear about their stories. One of the things that I always will do is for those who had a PDA surgery in the NICU, I'll ask them to hold up, their hands of how big their scar is. And obviously they can be 6 to 8 to 12 inches. They're quite large by adulthood. And I will hold up my 2 fingers about an inch apart and say, would you believe it was this small when the surgeons operated? Sort of the context of recognizing just how much they've grown and just how much they've come through, I think has been really important. And for these individuals, and it's fun to talk to them and sort of get their perspective and hear from them. I also love having trainees, and one of the things that's been a great joy just in the last couple weeks is watching manuscripts and papers that trainees from the lab have put together, and also acceptances for national talks and things, to see them succeeding in as we tell this story. And so I love having them come in as well.
Language is extremely important, and you've just said something that is absolutely amazing that I want to emphasize, in that a lot of the time when parents of preterm babies have surgery and have a scar, they always worry about what's the scar going to look like when my child is older. And I love how you reframed the growth in the scar as a reflection of how well they have done and how much they have grown. And it's almost a badge of honor rather than something to be worried about and ashamed of. So I absolutely love that. And just final question, for our listeners who are parents, caregivers, or even young adults who are born preterm themselves, what is the one key message or piece of advice you'd like to share based on your research and clinical experiences so far?
Several years ago, I gave my first talk at the American Thoracic Society conference, and I had an older gray-haired neonatologist sit down in the front row, and before I started talking, he asked me this question: "Are you here to tell me about my failures?" And I've thought so many times about that question, because I think we have a lot of fear of what's to come when these are some of the hardest days in the NICU. But I realized that I'm not here to tell you about failures. I'm here to tell you about successes. Okay? And even though there may be higher risk for disease or chronic medical conditions that some of these kids and adults will deal with, they're still successes, right? They're here, they're part of society, and they have a story to tell. And so I guess if that's where you're at right now, just remember there's so much growth and potential here, and you guys really are our successes.